When you had seen Dr. Fishman back in 2010, you were having some swelling and some discomfort in the calf area. Is that still problematic? When I was in high school, I kind of vacillated between being an educator of some sort and a nurse. And when I chose to go into nursing, I always kind of still had that pull towards education and working with kids. As a nurse practitioner, I get to educate patients and families, but also get to take care of them. That kind of nailed it, I think, for me. I'm Erin Spera. I'm one of the nurse practitioners in the Vascular Anomalies Center at Boston Children's Hospital. He's really here as a check-in, but certainly has this wound that, to me, it doesn't look like it's closing, but I also don't see it all the time, so I don't know what it looked like before, but obviously defer to your expertise to see what you thought about that. The thing that defines our approach is really teamwork. It's definitely a coordination type of role. We see a lot of patients that live both internationally and across the U.S., and it takes a lot of preparation for some of those more complex patients to get here. We often say that our clinic is like a spider web. The nurse practitioners are kind of in the middle of that circle, and then we kind of branch out to all of the necessary specialty providers when we need to pull them in or ask them questions or get them re-involved in a patient's care. I think sometimes it's really important for families to know that there's one person they can call to get multiple answers. So this is her first visit to see us, right?
Yes.
All right. And it looks like she's a pretty healthy girl otherwise?
Yes.
Doesn't see any other specialists for anything else?
Nothing.
Okay. The thing that makes us unique and continues to have us be a place that is sought out is we have the largest number of specialty providers that follow patients in vascular anomalies in the world here. And you have particularly new parents that come in and they get this overwhelming diagnosis. I think it's really nice to be able to help them decompress and understand that it is a community and that they're not alone, and that we have the providers that can help continue to understand things as symptoms or the disease itself evolves.